What is one misconception you would like to correct about brain surgery or neurological illness?
The most important misconception is the fact that once you have a brain condition, that's the end of your world. It is going to progress. There is no treatment for it. That is the commonest misconception, even for spine. Many people think that you touch the spine and do any surgery, you will become paralyzed.
Talk about that, right? Robotic surgery, remote assistance, and AI.
In my field, especially in DBS, I use AI a lot. We
Yes.
have now devices which will analyze the waveforms in the neuron. Previously, what happens is I used to go through looking each area and analyzing it. Now the AI analyzes the whole waveform and tells me, Dr. Raghuram, this is the most probable area where the STN nucleus is. Definitely, there are robots in neurosurgery and robots in other departments. If you compare that, the robots in neurosurgery do much more basic work compared to the robots in, say, general surgery or oncosurgery or neurology.
See, obesity and inflammation, or even a cholesterol, like metabolic disorders as well. I think everything like a slow poison. We are actually injecting or disturbing the brain cell. Do you see this awareness is coming in the current generation?
So if you have a very slow metabolism, you become obese, you tend to become more dull, you don't want to do anything, you don't have the energy to do anything. Now, if you're asking me about youngsters, especially people who are there, say 25, 26, they're all aware.
Any specific moment which deeply moved?
We had a very young child, but this child's parents were extremely distraught. They thought that is the end of the life. This was their very precious child after a long time of trying after marriage. And they just came to us and said that, please, doctor, this is the final thing. You are in now. We are in Mumbai. We can't go anywhere else. Please do something. And we went ahead and did the surgery. I was the main person involved. So we went ahead and did the surgery. We always talk about the quality of life. Most of our indicators or post-op outcome indicators nowadays are all based on quality of life. So it's not like somebody who is paralyzed and in bed and lives for 5 years, 10 years. So that's not quality of life. So you want people who are able to walk, do all that they want to do, and have a good quality of life. And that's the most important part of functional neurosurgery.
The kind of data we are able to get through different forms, right? So,
like we recently had, coming to AI, we recently had a talk about how AI is going to change medicine, right? I think everybody is talking about in different specialties. So the conclusion was that if you adapt AI, you will be a better doctor.
This question comes in: have you ever scanned your brain?
Yes, I do.
Okay.
I do it maybe once in 2 years, sometimes even once in a year, just to make sure, because you constantly see people coming to you and saying that, doctor, I had no complaint, and now you're telling me that I have a tumor. I just had a mild headache. So, we know that anything can happen to anybody.
Final message, what you want people to know about the power of early diagnosis, hope, and brain health?
Definitely there is hope. We have, like I told you,
Thanks, doctor, for all the information overload on epilepsy and how we can create awareness, and how India, as with the population what we have, is equipped in all the hospitals to handle this surge, and the technology interventions, which is definitely breakthrough for all these chronic conditions, right? I want to move to pediatric brain surgery as well. So while you handle pediatric
yes,
brain surgery as well, so I mean, definitely there is an associated challenge when it comes to pediatric, with the nature of the children, and the emotions which goes through, and probably sometimes they may not be able to even talk about what's happening, right? So it's more of, again, idiopathic from a reason, also from the patient themselves are not aware, because it's their juvenile, and probably children is definitely not aware of what's happening. So and how do you what are the unique challenges you've seen technically, as well as emotionally, handling pediatric surgeries?
So it's always like that. When it happens to your kid, obviously you are more worried, right? So in a society like ours, in which it's so strong culturally, everybody is so strongly bound in a family setup, the emotional component is obviously huge when it happens to the children. So there are a very particular set of conditions which we often see in children, especially in tumors. Usually they are in the back of the brain, which is called as the cerebellum. Then they have something called hydrocephalus, which is an increased accumulation of fluid in the brain. Some of them have abnormal spine problems, which is called spinal deformities or spinal dysraphism. So these are all the common conditions that we see, and we treat them on a routine basis. So what are the technical challenges? Obviously, there is a challenge of anesthesia, right? So if the child is very young, if you ask me how old child have you operated, I've even operated on a 1 month old child, 2 month old child. So there is a challenge in terms of anesthesia. That is one thing. The second and the most important challenge is in terms of the blood volume, right? Whereas an adult can withstand some amount of blood loss, less 200, 300 ml, or sometimes even 500 ml. It's reasonably safe. You can go ahead and operate with a very vascular tumors. Whereas children, we can never do that because their whole blood volume is so small. So you have a very, very big challenge about loss of blood during surgery. So you have to be extremely careful when you operate on these small kids that you don't lose extra blood. You have to be very, very meticulous, very careful when you operate, and they don't tolerate very long duration of anesthesia. So all these multiple things, when we do the surgeries on the children's brain, we have to be very careful and treat them. And if it's a growing skull, you have to make sure that you don't use implants which will prevent the growth of the skull or which will harm the child in any way. So all these multiple things we take into considerations when we operate on pediatric patients, and that's a very unique and interesting challenge. And we have very, very well established protocols to do all this right now.
Yeah, I mean, it's a very difficult decision. I mean, it's more spontaneous. You have to decide at that time, like what will
Correct.
work for this children versus the other. I mean, 1 month is like too young to handle even, right? I mean, it's a very difficult to.
So sometimes we even stage it. So we know that this is a benign condition and the child won't get worse. So we kind of wait for the child to reach a particular age before we do the surgeries.
True. Yeah. Right. I think that at least they have the physical ability to handle such
Withstand it, yeah.
challenges. Yeah. Any specific moment which you want to share, which deeply moved from working with children, and the conditions improved? So any examples you want to talk about?
Correct. So this was during my training when I was finally a senior resident. Okay, we had a very young child which had come from interior Maharashtra, and obviously at that time we didn't have so much of technological advancement or the reach of these advanced kind of surgical things into these interior towns, which may be true in some parts of North India even now. But this child's parents were extremely distraught. They thought that is the end of the life. You know, this was their very precious child after a long time of trying after marriage. And this child had a huge posterior fossa tumor, which I was just telling you, which is in the back of the brain or the cerebellum. And we know that this was a benign tumor. But the pressure that it had caused on the rest of the structures around it had led to severe swelling in the head. Child had become very dull, not eating, vomiting anything that it takes. His vision had dropped and all that. And they just came to us and said that, please, doctor, this is the final thing you are in. Now we are in Mumbai. We can't go anywhere else. Please do something. And we went ahead and did the surgery. I was the main person involved. So we went ahead and did the surgery. And luckily, we were able to remove the complete tumor, and we were able to drain the fluid out, which was accumulating in the brain also. And like I told you, it turned out to be a benign tumor, and the child did dramatically well. You know, it started walking, it started moving, became as active as it was before, and you can see the tears of joy in the family. And to them, it was like we were like gods. You know, we know that it's not true. You know, probably some other neurosurgeon, if they had gone, they would have done it. But it gives you an immense satisfaction to see that this child is going to have a normal life, because we know these tumors don't come back, and they just have to monitor regularly, and it doesn't affect their cognition to any extent. So it can go back to school, do all the activities. So that was a very, very touching and life-changing moment during my final year of training, which still I hold very dearly. And my professors always used to tell us, you know, you are not God, so please don't get into this, you know, ego trap, which is, you know, that you are doing something that like God. So it's like, what is your duty? You have been doing, what is their purpose in doing all this is to make somebody else's life better. And actually, you're lucky to be in that position to be able to help. So that's how we have been taught, and that's kind of strongly, you know, in our mind, that please think the other way, that you are lucky that you have got a patient who has come to you for treatment. So it's like that. So that way, that was a real life-changing moment. And I still remember my professor's words. Please, you know, you saw a good result. Be happy on that day, thankful to God, and, you know, move forward.
True. You're very humble, right? I think, but I think from a patient standpoint, it's a life-changing event, and especially when it comes to children, it's really difficult times, and
Exactly.
both for children and the family. And
Yeah,
anything which improves their ability to function or do things as a normal child, it's very important. You know,
exactly.
it's very welcoming to change, see, and those are stressful times, right? I think I know today
Absolutely.
when you talk about brain, the amount of usage of stress is like a very very abusive term, right? Everybody thinks, but I think what you do and what surgeons do to revive the lives, and with all these decisions you're making on the surgery OR, those are stressful times both for patient
Absolutely.
as well as the
Yeah.
surgeons. Yeah,
Yeah,
I
some
think
of these surgeries go on for 10 hours, 11 hours.
wow.
So you
Yeah.
have to be, it kind of part of your neurosurgical training. And like you said, we are constantly planning in our mind, right? So even the day before surgery, we are constantly thinking what I will be doing, what this can happen. But in
Hmm.
spite of all that, as you encounter the tumor or as you encounter things during surgery, it can always change. It's a very dynamic thing. It's not
Yeah.
like, any other thing. It depends on each
It's not a
individual patient, right?
pre-planned. Yeah, anything can go
Exactly.
at the
So
time.
yeah, so that way that amount of stress is there. But obviously over a period of time you have been doing these things regularly, and then you get an idea as to how to manage each patient as it comes.
Very true. Um, So I think again, my question on the children, especially, we touched briefly earlier on the technology use and the mobile devices, and also the erratic sleep patterns. Because today the kids sleep very late. I mean, a lot of times I've seen that they're up with their parents outside, and then they sleep late. And do you see children getting a lot of neuro degenerative or probably kind of cognitive disabilities these days? They come to your
Yes,
practice, and because of the technology overuse or probably not sleeping well, be it a teenager or probably a younger children. So how do you see
correct.
that? And probably just want to create awareness for everybody, right? Because it's an important, sleep is the number one priority for everybody, but especially for children, in the growing stage. So you can't compromise.
Absolutely. Absolutely, Naga. I think that is the most important thing that we are talking about today. I think there is so much research on the scientific evidence on the fact that you should have a proper sleep. There is no doubt. It will help you in improving your heart function. It will help you in improving your insulin level of resistance, help in liver, kidney, brain, everything. So there is no doubt that lack of sleep or irregular sleep or sleep just prior to the sleep you're having addiction to mobiles and things like that, you don't get sleep, you go on watching. Like I told you, what happens with this is it becomes an addiction, right? So there are these non-specific unrelated reels or something that the AI of the computer or the mobile keeps pushing it on your device, and you keep changing and focus, then whatever is your natural pattern of sleep gets disturbed. So you have very short segments of sleep, and then you wake up startled, and then again you try to sleep, you don't get sleep for an hour, then forcefully sleep. So that is very very bad. So it's a very very important thing for everybody. Please keep your devices off, sleep at least for 7 to 8 hours in a day. That itself can solve many of the problems, not only of the brain but for the rest of the body also.
Right. And you see this is a common problem. Children come, then you see when you look at the children
Yes.
diagnosis in the practice as well.
Yeah.
Yeah,
Yeah,
lot.
primarily they may probably be going to their pediatricians in the beginning. By the time they come to us, they're actually having a severe disorder in terms of addiction or lack of focus or lack of clarity, not able to perform well in school. So by the time they come to us, they're already been seen by their family physicians or pediatricians. Yeah. So we do see that, and obviously they have to go through an intensive psychological counseling in addition to, less of medication therapy probably for children and more of counseling and other therapies
Counseling.
for children.
Yeah, very true. Again, moving to, I mean, combining this aging brain, Alzheimer and dementia, while we talked briefly during the conversation on Parkinson's, right? But again, uh, what I have read, one of the Alzheimer solution, which is research book I was going through, it while a lot of people don't think about brain and the irregular deposits which is happening between the cells, it's even when they are actually not eating well, let's say if there is a lot of sugar intake or probably insulin spike or even other stress related issues, so the lifestyle is continuous lifestyle impact is also actually impacting your brain, that people come to realization at pretty later stage when it
Very late,
develops
correct.
into a like for example it impacts your thought angles, or when it becomes a dementia or Alzheimer, or what I
Correct.
read is that if it has a uh, uh, I mean, impact in the dopamine, right?
Correct.
So, how do you see that, right? And from a lifestyle, do you see all this is coming today with more of do you see improvement after even the DBS or even more of drug, but changing their lifestyle, you see that they have patients have recovered better
Yeah,
and
definitely, definitely. Obviously, like I told you in the beginning, DBS is one intervention. You have to have a set of other things that you do to make sure that your DBS works well and you have a good quality of life. Definitely, high sugar has a significant effect on the brain. There are these very pleasure centers in the brain. Like there is an addiction of online shopping. Why happens? Some people just go on buying online now, right? So you know that it's because there is a dopamine surge in the brain. So it's called, it's a very, very known symptom. It's called putting. So when you have this, putting is a very, very medical term where we know that patients who gamble, patients who have these repeated things to keep on buying things online happens because of this abnormal circuitry involving dopamine. So it is a reward center in the brain, and which is also part of this circuit. And that's why they feel that the more I do, I feel more happy. So, and they keep doing this. Unless you break this cycle, you will definitely land up in trouble. So that is definitely one thing. And in terms of asking about DBS for Alzheimer's is your question, then
no, no, no.
yes, they have.
Yeah.
Yeah, there has been a trial. You may have read about it. So where they tried in an area called the Fornix. This is done by the Canada in Canada, which is a very well-known center for this kind of research, where they put electrodes into this particular area in the memory circuit, and they did find some minimal improvement, but it's still not reached a level of evidence where we can probably suggest this as a treatment to patients with Alzheimer's.
Yeah, because when you do the putting an electrode in the brain, the DBS for a more of a movement disorders, but can we also use for cognitive because you are already having some stimulations done in the other
Yeah.
areas too. So that's more of a curious question, as you said.
Correct, but
It's a
I want to answer that question because it is the most exciting field in the field of
yes.
neurosurgery is this functional neurosurgery. So now there is approved indication. When I say approved, it is approved by the FDA of the US for obsessive compulsive disorder, for
Hmm.
depression.
Hmm.
For many of these conditions, we know that
Oh.
there are areas in the brain in which we can put these electrodes and their obsessive compulsive disorder becomes less, their depression improves. So there is a lot of scientific evidence and approval to do all this. And what is the exciting field? The exciting field is patients who have addiction, patients who have anorexia. That means they don't eat, they become thin,
Great.
they become. For all this, there is research going on. Addiction, like you are a drug addict or you're alcohol addict, there is an area in the brain in which we put the electrode. This addiction becomes better. The anorexia improves. And all of you, all of us are aware that what Elon is doing with this Neuralink, right? So that is nothing like it's the same thing like DBS, except that it is stimulating the surface of the brain. It's not going deep into the brain. So it's the same thing that they put an electrode into the brain and then they do an MRI and identify the area which is abnormal, right? This is a patient who has paralysis below the neck,
Hmm.
but he's thinking about moving the mouse. So which area in the brain gets activated? So this electrode picks up that signal, sends it through a Bluetooth device to the computer. So I
Oh.
think I want to move my mouse towards the camera icon. So that mouse actually moves. So that is the kind of exciting field that we are in. So next step they are doing right now is that patients who cannot see because of problem in the brain, because the brain, this back area called the occipital lobe, is the one which controls your vision. So we place an electrode there. So once when it's active, we can see that that thing is coming there and getting it active. So that is the kind of advanced science that we are seeing right now.
Yeah, no, I think it's a very fascinating place to be in at this
Yeah,
point with the amount of AI and the kind of data we are able to get through different forms, right?
exactly.
So, yeah.
Yeah.
Uh,
Like we recently had, coming to AI, we recently had a talk about how AI is going to change medicines, right? I think everybody is talking about in different specialties. So the conclusion was that if you adapt AI, you will be a better doctor. It's not like somebody is going to take your job, but you have to be part of this AI revolution for you to get maximum benefit. Like what you were just telling me, in my field, especially in DBS, I use AI a lot. We
Yes.
have now devices which will analyze the waveforms in the neuron. Previously, what happens is I used to go through looking each area and analyzing it. Now the AI analyzes the whole waveform and tells me, Dr. Raghuram, this is the most probable area where the STN nucleus is. So you understand? So that way AI has helped me refine, because it has so much data from multiple centers. It has analyzed those patterns and got to that stage where it is going to tell me that this is the right area for you to put the electrode.
Because since you started the conversation on the AI, I wanted to, I mean, you are championing a lot of robotics surgery
Correct.
as well for the, especially, in your practice. So please talk about that, right? Robotic surgery, remote assistance, and AI, you're
Yeah.
saying that, it's actually helping, right? So maybe
Yeah.
uh, how you think the future would is looking like, right? And what is your message for the young neurosurgeons and medical students to actually start understanding the technology as well while they are
Correct.
practicing?
Correct. Yeah. So definitely the younger generations are much more smarter and they are more adept at using the technologies. We all know that, maybe because their mother started it when they were baby to eat also, they give them the phone, you Google, you search, you choose. So that way the youngsters are much more adapted to the newer technologies. And in terms of robotic surgery, definitely there are robots in neurosurgery and robots in other departments. If you compare that, the robots in neurosurgery do much more basic work compared to the robots in, say, general surgery or oncosurgery or urological surgery, because we don't have a cavity. Usually these robots have arms which go into the cavity and then operates. So that's how the surgeon just sits on a console and controls the movements of these
Controls.
robotic hands. Yeah. In brain, because it's not a cavity, it's a structure which is filled with brain. We have robots which push these electrodes into the brain. We have robots which push pedicle screws which we put into the spine, into the screws. So it's not like it is completely independent. It is surgeon controlled, and we don't do so much of full surgeries with the robo. We do a part of the surgery with robo, and the rest of it the surgeon has to do. Except for the act of pushing the electrode, the robo, or pushing the pedicle screw, the robo does not do. I have used the robos. It is very useful, especially when you have to do multiple electrodes for a, say, epilepsy patient. So there is definitive role, and that is going to be the future. So if
Future.
you really are a young neurosurgeon or a medical student, there is no escaping from learning this technology and learning how to use them effectively.
Yeah, I think it's going to enhance your skills and also
Correct.
solve a lot of things easier for you while you're focusing on how to actually help the patients do better, right?
Correct.
That's true.
So there is no doubt. See, that's the whole idea, right? All our goal is to make the patient quality of life better and get better results. So I think there is nothing saying that you should not accept these technologies. I understand the old timers may probably say that
Hmm.
you're, like we were discussed in the beginning, right? That you're not using your brains enough. It's not like that. You try and use it in a way that it is beneficial to the patient in the
Right.
maximum, and you reduce the errors, right? We
Yeah.
want to
Yeah.
reduce errors and maximize efficiency. So that way, I think we should adapt technology and move forward.
Yeah, as you rightly pointed out, while it might take probably 2-3 hours or even a day for analyzing the entire data which has come from different imaging, but now it's easily done without any missing any small information
Correct.
intricacies as well, and given to you, so which
Correct.
is actually helping you to take more patients or look at patients much more faster than it could have
Correct.
taken earlier, right? So yeah,
Correct.
it is definitely breakthrough. And I think going back to our question on the lifestyle, right? I think what I see, obesity and inflammation, or even a cholesterol, like metabolic disorders as well. I think everything has a slow, like a slow poison. We are actually injecting or disturbing the brain cells. So
Yes.
the awareness of how this could lead in 30 years later is very less, right? So I think I wanted to pick your brain on, do you see this awareness is coming in the current generation, or do you see this understanding that when you have sugar, maybe a stroke could be coming, or something like a paralysis could be coming if you're obese, then there is a constant impact on your brain cells. So I just want to pick your
Correct.
mind on, how do you see this
Yeah.
lifestyle?
No, yeah, it is a very, very well known fact and very scientifically researched, right? So,
Hmm.
if you have a very slow metabolism, you become obese, you tend to become more dull, you don't want to do anything, you don't have the energy to do anything, your focus gets affected. The commonest word that you use now after COVID is called brain fog, right? So, you tend to develop brain fog. So, it is all known. So, now if you're asking me about youngsters, especially people who are there, say 25, 26, they're all aware. I mean, I know that the younger generation eats a lot of junk and high sugar food. Maybe we are aping the West in terms of doing that. If you go to a mall on a Saturday or a Sunday and just
Yes.
visit the food court, you'll say that okay, all the
Amazing.
doctors are good.
Yes.
We will have enough patients for another decade. You don't have any problem with that. But that's not good for the society. So we do try to keep on informing them that it not only your gut or not only your liver, it definitely indirectly affects your brain. It definitely
Right.
affects your cognition. So it is very important that you avoid all this high oil, high sugar, high sodium food, and have a very good healthy lifestyle with regular exercise. So that we know that there are endorphins, right? Endorphin is a very specific chemical which get released when you do exercise, when you play sports. So if you don't do all this, eat junk food, sit in front of your mobile, definitely it is going to affect your brain health. So we should make a conscious effort to do activities which improve your brain health.
True. I think it's physical. I think what I also read in research is like people who have stronger legs, like they run and do, they have a big brain. So I don't know whether it's true, but I saw, read that maybe it's more of physically active. So you're strong,
Exactly.
and your brain is actually active.
Yeah.
I mean, and then you sleep well. There are a lot of factors associated to it, right?
Correct. Correct.
Uh,
Very true.
and yeah, I think I covered pretty much what I wanted to cover from brain standpoint. So the last segment I want to quickly, I think I've named it because I know that being a neurosurgeon, I definitely cannot do justice in one conversation for sure. I wanted to, I mean, while we deep dive the main black box of our human body, the brain, but spine is an important topic to talk about. So I will definitely do one more on spine, but this is like a quick scan, brain, belief, and beyond. So I'll just go with some questions. I wanted to get
Sure.
your quick answers on that. Neurosurgery isn't just about skill; it's about resilience. So, what was one moment where you doubted yourself, or how did you overcome it?
Yeah. So obviously, like you said, it is very, very highly skilled, especially for the fact that these movements that I do, I have some surgeries where very close to important structures in the brain. So even if you move your hand in a way that goes and touches another important nerve or 1 to 2 millimeter into the brain, you can have a patient who won't get up. Okay.
Hmm.
So that is the kind of resilience and control that you need to have. So sometimes you feel, oh God, am I doing something wrong? There have been instances, especially I worked in a government hospital in Bombay, and I would feel that, oh God, am I doing any justice to these patients? So many of them I am not being able to help. There are like 20, 30 patients, and we may be able to help only 10 or 5 of them, and the other 5, we may have to just manage or send them away. So then I used to have a long discussion with my professor saying, sir, is this correct? What are we doing? So he said, you can only do what you can do, Raghu. There is nothing like you can cure everybody or take illness out of this world. So that was the kind of a moment where I realized that you have to be really confident of
Yeah.
yourself, and your conscience is always going to keep asking you these questions, but do what you can do best for the patient. So that's the kind of resilience and constant motivation that you need to be in a
Perseverance.
field
Yes.
of neurosurgery. Yeah, because you
Yeah.
see so many problems all the time.
True. I know. I think it's medicine as a field itself is like requires a lot of perseverance.
Correct.
Right, because education itself, it takes a lot of time, and then the practice, and then you
Correct.
establish, and I mean, again, it's a traumatic experience every day when you see
Yeah.
the patient. So constantly you have to have a stable mind, and when you do
Correct.
surgery, that's a much more difficult
Correct.
high, you're in a high mental state.
Correct.
So
Adrenaline, high
have you
adrenaline.
ever
That's what we call it.
yeah. No,
Yeah.
again, this question comes in. Have you ever scanned your brain?
Yes, I do.
Okay.
I do it maybe once in 2 years, sometimes even once in a year, just to
Yeah.
make sure, because you constantly see people coming to you and saying that, doctor, I had no complaint, and now you're telling me that I have a tumor. I just had a mild headache. So, we know that anything can happen to anybody. So it's a good
So,
practice. I mean, it's not recommended screening test, right? So we know that it's not like your regular cholesterol checks or a ECG checks or a TMT checks, which are all recommended right now with scientific evidence. Brain scan is not a screening tool. It
screening
is
tool.
done
Yeah.
to be done only on the recommendation of a doctor.
Yeah. So Dr. Amen, who's also, who's written a lot of books on the brain and how people can actually rewire and all. So he started his career with imaging the brain. So he said, a lot of earlier those days, the first thing people have to do is to, if they have anything of the stress and any kind of situations in there, the first thing they have to do is to scan the brain, but it was not a practice. So that, and then he
But
yeah,
stress is not a real inverted comma indication for scanning the brain. But obviously, when the
I'm
doctor
saying, yeah,
checks you and you find that
yeah,
there is objective signs which say that there could be abnormal, then definitely you should go ahead and scan the brain.
yeah. The next question: is there a surgery that changed how you saw yourself as a surgeon or a person? Maybe one that humbled you or surprised or pushed your limit or to evolve.
Correct. So it keeps happening all the time, Naga. It's not like
Okay, it's not one.
one-off surgery.
Hmm.
Yeah, that would surprise you. And I mean, I did a surgery for a patient who had like a 7 centimeter tumor in the brain, which was compressing everything, and it was a benign tumor. So he didn't know anything except for the fact he had become dull. So the
Hmm.
family thought he's gone into depression and took him to multiple other treatments. So I spent, like, I think it was about a 12-hour long surgery. It was stuck to many important blood vessels. We removed it completely, and now he's back to his normal life, going back to his work, enjoying his family life. So that kind of really humbles you, that how you could make this. Otherwise, this fellow would have just been, withdrawn and gradually gone down further and not done anything. And when you see him today, you feel really happy. And even children like that, some children I would have treated like 10, 12 years back, they come back to you grown up, and they're like
No,
happy, saying that
yes.
I'm going to school, I am playing football, I am playing cricket. So then you feel so happy. Oh, I was able to make this positive change in this child, and you feel happy that day and that you have done something in life. Yeah,
No, it's an ongoing emotion, right? Yes, I know. You
yeah,
cannot
yeah,
put one
exactly. And
surgery or
there are
one
challenges,
moment.
right?
Yeah.
Yeah, and it's not like it's always like that, right? Sometimes there are challenges. You feel you have done really well, and then that person does not do well. So that is also happens. So it's both the ways.
True, true. Next question is, what was the most difficult decision you have made in a surgery, and what did it teach you about responsibility or humanity? Any
No,
difficult
see,
decision?
exactly. So many a times you have to do that, right? So you have a, even say for DBS, right? So we have had challenges. It's not like it's everything goes smoothly. As your learning curves improve, you obviously achieve a level where you can manage everything. So during that curve, you obviously have challenges. So sometimes you have had a challenge where the patient, because it's an awake surgery, he will refuse to cooperate. He
Hmm.
starts screaming, he
Hmm.
starts shouting, saying that
Wow.
I don't want to undergo the surgery, I want to get up. Because their head is fixed to the table, because we do it in a way
Yeah.
that the patient
The
does
head is
not
not
move, because I
moving.
have to
Yes.
be,
Yes.
exactly, I have to be highly accurate. So
Hmm.
then we have to stop the surgery, come around,
Wow.
reassure him, or probably stage the surgery. So these are all challenges that we face quite often. And as you learn over a period of time, then what you do is, obviously we counsel them much before and also know how to handle all these problems.
And those are, I mean, in between the surgery, if a patient reacts like that, I know it's a very tough spot to be in, and
Correct.
then
Correct.
trying to
Yeah.
still empathize with them, and then bringing back or staging it is,
Yes.
as you say, it's a tough one too.
Yeah. So we take that call. If we
Yeah.
find that is absolutely not cooperating and it's going to be more risky than proceeding,
Hmm.
then we take the call to stop it, even if it means that you'll have to do it again, you'll have to do it another day, there are
Everything. Yes.
financial things involved. We take the difficult call and do it like that.
Hmm. True. No, that I think ultimately it, everything has to come in place. Otherwise, even one small error could be a bigger disaster, especially when it comes to
Exactly.
brain surgeries, right?
Yeah.
Yeah. Um, how do you manage the emotional and psychological weight of your work, and especially when outcomes are always not in your control? Like as you said, this sometimes the patient doesn't cooperate,
Correct.
or even the situation doesn't warrant, or maybe the complexities changed after you started surgery, so it could be so how do you handle, keep yourself calm or emotional
Correct.
and
Yeah.
psychologically?
Yeah. So it does take a toll on you, you know. So it's not easy, right?
Mm.
Especially you when you are so closely involved with the whole patient and their family, right? They trust you. So you know that is what is the most important thing. There is so much of trust from the patient sides on you, and they have come to get better, and they hope that you will be doing the right thing. And sometimes the outcomes are not as you expect. So then it does take an emotional toll on you. You feel, oh God, did I do anything wrong? You go through the whole thing in your mind again. You come back home, you sit down and see, is there anything that I could have done, could have changed the outcome? And sometimes, in spite of you following everything to the T, things can go wrong. So there
Yeah.
are many articles. This is called the inverted comma God complex. So obviously, the neurosurgeons are the ones who realize it the most. So even though I have done the best, it doesn't turn out the way that it was. And sometimes, even if you have an
Mm.
issue patient as well, so you come back, relook at the whole thing. Probably it affects your mind for a day, two,
Mm.
sometimes even more. And then as you learn, like I told you, as you get older, you know that these patients will definitely get better even if they had an initial challenge. And we counsel the family and talk to them and take them into confidence and then move forward. Obviously, I do reading, I do read some books, or I would probably do something that will take my mind off these things for some time. And that's how we take care of our whole emotional health. And I do have an hobby of cooking. So when I come
Okay.
home, that's a big yeah. So that's a big
Relief.
distraction, relief, and thing that I do. So it takes me off the neurosurgery, and I concentrate on spending
Yeah.
time with my family and my son and all that.
No, right. That's right. I think it's not just takes toll on only on the your own emotional, but with the family, and when you have to come back, you are still have to talk to your son and your
Correct, correct.
wife, and
Yeah,
your mother, everybody. So again,
exactly.
a lot of times people forget that doctors are also human beings.
Correct.
They
Very
have
true.
emotions.
Very true.
Yeah, yeah.
Like we have
So
had colleagues, especially during COVID times, who would break down, right? They would
wow.
feel
Yeah.
so helpless, right? So they would just cry because they
Mm.
felt that, oh God, I have been trained to help people and I'm not able to help this particular
Mm.
gentleman. We have had many doctors in that time who own colleagues used to have COVID and have severe illnesses. So that way, it's a very, very emotional roller coaster ride for the doctors who treat all these patients with difficult conditions.
Yeah. True. I know. I think the kind of cope up mechanism you'll have to constantly build, because what comes you cannot predict. So every day
Correct.
is like a new experience. So that's fascinating as well, as you say, when you look at the brain, but also taking a toll on your own brain health and mental health. So
Correct.
um, I mean, you said you talk. I mean, I have the next question in terms of the routine, but you said cooking is one of the therapy. You kind
Yes,
of
that's
get
what I
relief.
do.
Yeah,
Yeah.
that's a. I
Yeah.
also like cooking. It's true. It's a therapy
Yeah.
actually. If you
Yeah.
and the output, it comes out so well. If you
Correct. I know.
like.
I know. I know. Doctor, my wife Jyoti keeps saying that, how do you do this? You finish and then you come back here and you want to do same thing in kitchen. You neurosurgeons are too much. You want to be in control all the time. I said, no, it's not a control. It's just my way of releasing all my stress and tensions. That's all.
Yeah, that's true. I agree. Um, so, have you ever had a moment during surgery, especially on the brain, where you just paused, or probably fascinated looking at the organ you're working on? Any freeze moments during surgery, or like that happened in over
Yeah,
the years?
yeah, many times,
Anytime.
especially when you operate on the base of the skull. Okay,
Oh.
so if
Mm.
you really look at the way it's being done, it's like amazingly brilliant and beautiful. That's why we haven't reached a stage where a robo can do everything that the brain can do. Like you just
Mm.
close your eyes now and say that you are in Goa, or you are in Miami, or wherever. Your brain can immediately give you those pictures, right? So that's how beautifully it's wired, and the kind of the way the brainstem is designed, and the way beautifully the blood supply and other things that are arranged for all that is like a real freeze movement. You feel really amazed at the way the things are done and how beautifully it is structured and designed in a way to work so wonderfully in all of us.
True. Yeah. I know when thinking about it, when you're reading, brain is a curious subject to actually read about.
Correct, correct.
When you're doing it and looking at it day in, day out during the
Yes,
surgery, there's a lot of goosebumps moments you would encounter,
absolutely,
right? For sure.
absolutely.
And what role learning play even today in your practice? I know that you are constant believer of, and technology intervention is something which you already talked about, but I wanted to hear it from you, so that anybody, not just in the medicine, but every practice or every domain, there's a constant need of learning because of the technology advancements. So how do you see that? How, what role does technology or the learning in your practice play?
Yeah, it plays a significant role now, especially in many specialties, including mine. Like I already told you in my specialty what we use, but if you see other specialties like radiology, which involves reading the scans and images, there has been so much advancement that even in our own places now, the normal scan is most of the time reported through AI. That means it will definitely pick up anything that is abnormal and show you. So for a normal scan, you can just quickly go through all that and say that this is normal and move forward. And like you were already telling me how much time it saves, so that you can
Hmm.
concentrate on a
Yeah.
difficult case where there is an abnormality and you need to identify it particularly, and probably diagnose it in the right way so that the patient can be treated. So you can spend more time on that rather than just doing the routine kind of a work that you do. And AI in other things also can analyze your data and symptoms. I mean, I understand that probably in some time now, ChatGPT, if you just probably enter your symptoms, it can even give you a prescription. So that's the extent of which it is being publicized, and the data that it can analyze. Obviously, our mind also is very fast. Our brain is equally fast, and we can analyze. We just saw how Magnus Carlsen defeated an AI in chess, right? So it's
Yeah.
not like our brain doesn't work fast. So obviously, that AI bot had enough moves of chess which it had analyzed, and it thought it could defeat the world champion, but it could not. So obviously, our brain is equally strong, and we just need to use it, but
Use
use it
it.
in a way that both of us are helped, and it kind of makes you patient centric and patient oriented, so that you can be more safe and more good to the patient.
I think very well said, Doctor. And use it wisely. Yes.
Correct.
Yeah,
Absolutely.
yeah,
Absolutely.
yeah. And even the AI is built by human. So
Correct.
of course we have
What to
the,
feed? Yeah.
yes, yes. So
Yeah.
what to feed? The right prompt, if you give, it will give you the right. Again, everything is available.
Correct.
What to take and what not to take is more of a decision which
Exactly.
you have to decide. Right. Yeah. I think, but you still feel. I mean, while robotic surgeries are all very well, um, uh, very advanced, I think I strongly believe certain things or the human in the loop and the emotions. I don't know. I don't know the general intelligence of a human, or probably the emotional intelligence of the human would be mimicked by AI. It's a long way to go. Or do you think that's
No, no, it's
definitely not?
absolutely true.
Yeah.
Absolutely true. Because right now, this robotic surgery doesn't mean that the robot is performing independently.
Yes.
Okay, so that has to be clear to the audience.
Hmm.
Robotic surgery is just like another device or a tool which is being used by the doctor for the surgery. It's not like the robots are acting independent of the doctor. The surgeon is sitting and controlling the movements of these robotic arms. That's all. So what, our hand does not rotate 360 degree, whereas the robotic arm can rotate 360 degree. So that is the advantage. So it's not like the robots are doing the surgery. The surgery is still done by the
Still
surgeon.
done by the
So
surgeons.
yeah, so there I don't anticipate in near future at least that the robo is going to take over completely. It will still be completely supervised by a surgeon or a doctor who is treating.
Okay, got it. No, no, that's true. Yeah, I know. I wanted to hear it from a doctor, right? So it's, and
Yeah,
especially a neurosurgeon, right? It's important
yeah,
to everybody to understand that however technology you use, but still there is an emotional angle to it, which is important,
correct,
especially in the field of
correct.
medicine.
Yes, and there are a lot of ethics involved, right?
Hmm.
So obviously
It's true. Very true.
you can't
Hmm.
expect that from a machine. So obviously emotion and ethics and the empathy that you see will all always have to come from another human being the doctor. Yeah.
True. Thank you, Doctor. I know you are a pioneer at probably a leading neurosurgeon, right? But if someone asks you what makes a great neurosurgeon, what would you say beyond the obvious technical skills? That's
No, like I told you, what my teachers have always taught us, thanks for saying that I was reading neurosurgery. I do work, I'm like any other good neurosurgeon or an average neurosurgeon in India. But what is the main thing for you to be a good neurosurgeon is the most important thing, like you already suggested, is to have that emotional connect and empathy with the patient. I think not only for a surgeon, but for any doctor. And for surgeon all the more, because you need to know when you should cut and when you should not cut. So the most important thing that is taught to us in training is when you should not cut, which is the Bible books right in their first forward pages. You should know when you should not operate, right? So that is the most important thing. Once you know that when you should not operate, obviously you will become a good neurosurgeon. In inverted commas, like the technical skill and all other things are
Yes.
secondary. But if you are just not knowing when you should not operate, that would not make you a good surgeon. For you to be a good surgeon, you should know when you should not use the knife.
Amazing. I think excellent point, Doctor. I think it's a true completely to the general belief, right? When mostly people associate, okay, if I go to doctor, the first thing they'll do some scans and go into surgery, right? But actually, when not to, that's a very powerful thought to share.
Exactly.
Thank you for that.
Yeah.
Yeah. What is one misconception you would like to correct about brain surgery or neurological illness?
Yeah. The most important misconception is the fact that once you have a brain condition, that's the end of your world. It is going to progress. There is no treatment for it. That is the commonest misconception, even for spine. Many people think that you touch the spine and do any surgery, you will become paralyzed. So that is
Yeah.
no longer true. We have so much of advancement in terms of infrastructure. We have things which are called navigation. That means these equipment guide us to the area of the tumor very, very safely, and we can completely remove the tumors because of these machines and other artificial intelligence things that these guys help us with. The biomedical engineers help us with. So please do not worry if you have a medical condition involving the brain. There are many, many options, and most of the surgeries are extremely safe now, and you will have a good outcome. So that is the biggest misconception that people have, that you have a bad outcome all the time. It's not true anymore. We have excellent kind of support and systems with which we can make sure that your quality of life is not affected and your disease is taken care of.
Very true, doctor. I think there is a lot of disbelief, right? That, as you said, if you have a brain, maybe injury, I think a lot of people understand that there is, okay, you can actually recover from an injury, but anything which is more of a cognitive impaired, or
Correct.
probably there is a neurological disorder, then there is a resort and there is a progressive improvement which can make the life better, as you say. Correct.
Correct.
True.
Correct. Definitely, it is there. Like I told you, but it's not like reversible or anything like that. Even in conditions like that, we have a lot of hope. So you have to meet the right specialist so that you get the right treatment.
Yeah, at least you can live the rest of the life in a better way, or the
Correct.
increase the life expectancy, or probably the longevity to an extent where you're not suffering all the time. So it's important
Correct.
that
Yeah. So you should have a meaningful life. So that is the most
yeah,
important thing now in neurosurgery. We always talk about the quality of life. Most of our indicators or post-op outcome indicators nowadays are all based on quality of life. So it's not like somebody who is paralyzed and in bed and lives for 5 years, 10 years. So that's not quality of life. So you want people who are able to walk, do all that they want to do, and have a good quality of life. And that's the most important part of functional neurosurgery.
right. No, true. Completely agree to that. If someone's worried about their parents' memory or loved one's tremor, what would you tell them today?
Yeah. So memory, obviously, and tremor, please come and consult your neurologist. If you have difficulty accessing, even your basic family physician will be able to make a reasonable diagnosis and put you on the right treatment. But if you have access to a neurologist, better come and meet them, both in terms of memory loss. Simple things can also cause memory loss, like vitamin B12 deficiency. So please do not hesitate to come and meet the doctor. Something like a B12 capsule or a B12 injection can dramatically improve your
Right.
memory if that is the reason. And tremors, we
Hmm.
have excellent medications. It's not like every tremor patient will need surgery. There are very good medications which we can give. And if it doesn't get controlled, like I told you, for tremor, we can completely stop the tremor. We can be very confident that the tremors will stop. That kind of high level, high precision surgical procedures are there. and we can always do all that.
Okay, got it. Thanks, doctor. Um, Final message, what you want people to know about the power of early diagnosis, hope, and brain health.
So the first thing obviously is early diagnosis. So that holds true for any condition in the body, right?
Mm.
So if you identify when you are pre-diabetic, or if you identify it when your blood pressure is slightly high, and you involve or modify changes in your lifestyle by terms of exercise or diet control, or having a more less stress-free life, all these conditions can be prevented from worsening. So early diagnosis definitely has a significant role. So please do not listen to people who say that the health checks are a scam. You don't have to do health checks. Once you do a health check, they will identify something in it, and then they will put you on treatment. I mean, maybe there are 5 or 10% of people who will fall into the trap, that somebody does that. There are some black sheep who will do that. But please, on a scientific kind of a place where we are living in a scientific society, there is definitive role for these kind of health checks. So definitely do a preventive health check at least once a year, so that all your regular parameters are seen, and make sure that they're all right. So at least you can pick up something early, and then you can appropriately treat it. So that is in terms of having an early diagnosis. Definitely there is hope. We have, like I told you, treatments for many conditions which were not there previously. There are
Right.
so many scientific advancements happening in terms of genetic therapies. Very, very soon we may be seeing coming them into practice. Right now they are in the trial stages. So there is definitive hope even for neurodegenerative conditions. And that is the brain health is obviously is the most important thing. We already discussed multiple things. Please make sure that you keep your brain active and healthy. Avoid things which make you sleepy, drowsy. Avoid high sugar, high fat, high sodium foods.
Alcohol,
Definitely do some,
smoking.
yeah, alcohol, smoking, big danger. And definitely do an activity which stimulates your brain, and exercise which will always activate not only your brain but your spinal cord and rest of the body. It's very, very important that you look at brain health as a whole and make sure that you have a good, healthy lifestyle.
Thank you, Naga. It's great to hear um, that as an end note from a neurosurgeon talking about the importance of brain health, right? So nobody else can, give that message very powerfully. And thank you so much, Doctor, for unpacking the mystery of our human brain, right? I think today, I mean, I thoroughly enjoyed the conversation and a lot of learning through this, right? I think I kind of tried my best to get the right questions to you and the research. So
Yeah.
thank you so much, and
Thank you.
definitely I will get you to the important part of the human body is spine as well, which connects the
Sure.
brain into a, so we will have a conversation on that. But thank you for doing
Exactly.
this on a weekend.
Thank you. Thank you so much, Naga. It was very interesting. And obviously, you had the right questions and done a lot of research on all the topics. So it was very interesting to share my thoughts and the way we do it right now. And it was a very, very interesting discussion. Thank you so much for having me on your podcast.
Thank you, doctor. Have a wonderful evening and meet you next time.
Sure. Thank you so much. Bye.
If you liked this conversation, please hit the like and subscribe button to get the latest updates from my channel, Caffelog with Naga. Thank you so much.